I'm here with Richard Tyler, Chief Executive of Horder Healthcare. Richard, how are you?
Hi, Lynn. Yes, all things considered, very well, but challenging times ahead, I think. We're in uncharted territory for so many people at the moment, so keeping well and keeping fit and getting through this is probably very important at the moment.
Yeah, very challenging times, which Horder Healthcare are going to play a huge part going forward. So just briefly, before we talk about how things are changing, we have the Horder Centre in Crowborough, the Mackindo Centre, East Grinstead. They are part of Horder Healthcare. You are the Chief Executive. Just to remind our listeners, could you just give a brief overview of what those hospitals currently provide?
Okay, so two sites. The Horder Centre in Crowborough, we're an orthopaedic centre. We're known as one of the largest single-site providers for hip and knee replacements in the country, and we obviously treat all aspects of orthopaedics, which is everywhere from your foot and ankle all the way up to your shoulder. And we've been doing that for a long time now. We have an outstanding rating with the CQC, very highly regarded by our partners in the NHS, and about 80% of what we do here at Crowborough is NHS-based work, so we're doing work for the local NHS at the moment. We also provide physiotherapy at Crowborough. We provide a large amount of community physiotherapy throughout East Sussex, and we provide that at Crowborough as well. So that's what we provide at the Horder Centre in Crowborough. At the Mackindo Centre in East Grinstead, we are providing plastic surgery, maxillofacial surgery, which is surgery of the jaw, a large amount of ophthalmology, which is surgery for the eyes, as well as some orthopaedic work that we also do over there, again supporting the NHS with their work in Crawley and in West Sussex. So a good range of services across both sites, working very closely with the NHS already in a lot of areas, particularly around hip and knee surgery.
So, successful business.
Yeah.
We're in very challenging and strange times. There was a big announcement at the weekend, and that is that the NHS has struck a deal with private and independent hospitals to acquire thousands of extra beds, ventilators, medical staff to fight the coronavirus outbreak. How is this going to affect you, and what is the deal?
Yeah, of course. So this is really important, I think, and it's really significant. So as the independent sector, we've been working closely alongside the NHS for the last few weeks. We've been talking about how we can best help the NHS. As you say, it's unprecedented times. So that essentially the way that the deal is going to work is that the NHS is going to utilise almost all of the independent sector capacity across the country, which is in the region of 8,000 beds, plus the operating theatres, ventilators and so on and so forth, so that we can provide additional capacity to support the NHS during this period. We'll be funded by the NHS to provide that. It's very important to say that this is the independent sector will not be making profits from this. We'll be funded for the costs that we incur during this period, and it's very much about us working in partnership to make sure that the NHS can cope with the really high quantity of COVID-19 patients that we are expecting to emerge over the next few weeks and months. So it's an important deal. It's a sign that we want to work together. I think from Horder Healthcare perspective, we've always worked very closely with the NHS. We think it's really important to work with the NHS at this time, and it reflects our ongoing commitment to work with the NHS and work in partnership. So it's early days, it's going to be a challenge to put things in place very quickly, but we're all committed to doing it, and we're all committed to doing what we need to do to support people through what is a very challenging time for everyone, I think, at the moment.
So from now, the usual route for patients has completely changed. Your patients will be coming to you from a different source.
That's
correct?
right. So the details still to be worked out, but at the moment we do what's called planned surgery. So if you have a hip or a knee replacement, that surgery is planned sometime in advance. You know when you're going to arrive. Everything follows a clear pathway. It's likely that in order to support the NHS, we're going to work, but in Crowborough, we'll be working very closely with Mason and Tunbridge Wells NHS Trust, and it looks like we will be taking more trauma-based patients. We think probably orthopaedic trauma. What that means is we'll be treating people who have, say, broken their hip when they've fallen in the street or fallen in their house, and they will be brought here from the main hospitals for in Pembury, most likely in Tunbridge Wells, and we will then treat the patients here, manage the trauma, repair the fracture, and then help with their rehab moving forwards.
Okay, so that's Horder Centre.
Yeah.
What about Makindo?
So Makindo Centre, again, early stages. We're in discussions with both Maidstone and Tunbridge Wells and the Queen Victoria Hospital in East Grinstead, which is on the same site as the Makindo. Not entirely sure yet what we'll be doing. Very, very early days, bearing in mind this announcement was only made at the weekend. But I expect over the next week we'll become clearer about what we're doing to support the NHS. And I think the broad principle of, and what's so important about this agreement is it's effectively saying we're making our facilities available. As long as we can provide the services that you need safely, we're very happy to do whatever it is you need us to do at the moment. Now that may well change over the next few weeks and months, because obviously we don't know exactly how this is going to pan out in the longer term. But we're essentially saying, look, we're here to help. We will do what we can do. I can't stress enough it's what we can do safely. So obviously, the facilities we have here have to be used responsibly, and all of that's being discussed with the NHS at the moment. So I'm confident that by the end of the week, we'll be very clear about what Horder Healthcare is doing to support the NHS during this time of crisis. And
you mentioned Maidstone, Tunbridge Wells. Do you know at this point if we'll be taking patients from other areas, East Sussex, Wealden areas? Do we have any information on that?
We don't have any information as yet. The process is being coordinated by the NHS and tends to be coordinated by the NHS trusts. So in terms of geographical distance, we are closest to Maidstone and Tunbridge Wells and obviously the Queen Vic. And the conversations so far have been with those organisations. Obviously, as I've said, we're very open to support the NHS for whatever it needs. So we may well be having conversations with other organisations such as East Sussex in due course, but at the moment the conversations are focused around essentially around West Kent and the East Grinstead area.
I guess at this point, nobody really knows where we're headed, do we? It's this uncharted territory, not just with healthcare, in so many different ways. We just have to know if we're ready. Are you ready?
I think as far as you can be, we're ready. I think we will be doing things that we do not normally do, but we have highly qualified staff. We have some excellent surgeons who are very experienced in all aspects of orthopaedic care, whether it's planned care or trauma, and we will do what we need to do in order to support the NHS. Our back office staff, our admin staff, our catering staff, our portering staff all remain committed to what we're doing. We've been briefing staff over the last week as things have emerged, and I think it's fair to say that there is a considerable level of commitment to make this work. We wouldn't be human if we weren't concerned. I think on a personal level, we're all slightly concerned about ourselves and our loved ones and how quickly is this going to spread and what does that mean, and that's perfectly understandable, and we are reassuring people as best we can whilst supporting them. But yes, we are as ready as we can be, and I've no doubt over the next couple of weeks we will get ourselves where we need to be in order to support people going forwards.
It's a team effort, isn't it? So how can the community help? People outside this hospital, I'm sure people will want to help. How can they help you?
So the obvious things are to support our staff, and that means supporting them when it's making the shops available earlier in the mornings for staff, making sure that they can access the food that they're going to need. Treating them with respect when you see them is really important for us. And I think on a practical level for us at Horder, we are contacting all of our patients at the moment because clearly we've had to cancel a lot of our planned patients. That's been difficult. It's difficult for them. We hate doing it because they do clearly, people want their treatment. So we've been cancelling patients. And what we would say is, please don't call us. We will contact you. Look at the website, look at the details on the website, but you will be contacted either by phone, by letter, by email. So bear with us as we do this. As Lynn has said, we're on uncharted territory here. We've had to move very, very quickly over the last week to move lots of things around, undoubtedly cancel patients, which has been difficult both for the patients and for the staff. And I would say on that note that if we are phoning you, I know it's difficult, I know it's not what you want to hear, but please just remember that the staff are doing their job and they will do it with respect. And if you can just treat them with respect and courtesy, that goes an awful long way at the moment because everybody is doing things at speed, and it's just good to know that they are supported in that.
Thank you, Richard. It's good to know, and Good luck to you and your dedicated team, both at Horder Centre Crowborough and McIndoe Centre East Grinstead. Very challenging times ahead, and I'm sure all our listeners, everybody listening to this, would give their grateful thanks to you and your teams at both of those locations, and good luck over the coming weeks, months, however long this continues.
Thanks very much, Lynn. It's much appreciated.
Thank you.